just come up to 1,900 lung transplants, and we've been working with Lungitude obviously for a number of years to translate science to real patients. And we're looking at better matching of donors and recipients using some of the standardised tools and applying them better, and new ideas, and the speakers will talk to that.
So in terms of lung transplantation, these non-HLA antibodies can cause tissue destruction following transplantation. And one thing that we're really grappling with is sort of some more bigger questions, whether these antibodies are actually causing the damage or whether they're just indicative that something wrong is happening. We do think that testing for non-HLA antibodies pre-transplant might be useful to help guide treatment to avoid antibody-mediated rejection.
And so we used computer algorithms and forms of artificial intelligence to process and really analyse this data in a high throughput and a novel way for the field. We can use the data to what we call create a model to calculate the risk of someone having CLAD. So we can use the B cell count at the pre-transplant time point and feed that into mathematical modelling. And so this is the formula here. What this would mean is if you had a B cell count, you can feed it into the equation and you get a probability or a likelihood that you may go on to develop CLAD within the first 3 years of your transplant.
So the whole idea is really, can we go from this sort of protocolised approach where we treat people the same and reactively to can we use these immune biomarkers to sort of individualise what we do a bit more specifically?
And so for the purpose of this talk, I really think that rather than just thinking about peptides, maybe we can just think about lollies. That's much better, right? Everybody enjoys that. So where's this all leading to? And I think that's a really important question. And so what we want to do is we want to sort of be able to provide a very simple, non-invasive blood test where we can isolate T cells from recipients. We can, stimulate them with this mixed bag of peptides or lollies and try and work out, which T cells are being activated.
It's clear we are translating results to patients and other lung transplant programs, and the talks that have been given by the members of the team at very senior, world meetings have been very well received. And I'm proud to say that it's absolutely clear when you look at where we sit in the world, we're clearly amongst the 5 most important programs in the world. And if anyone's got a new idea, then they're certainly they'll reach out to members of our team. And so that the work that we do is translated locally, but it's translated to the rest of Australia and outside, and I'm really proud to say that.